On this Monday night, the Prime Minister hammers home the importance of staying home.
We've all seen the pictures online of people who seem to think they're invincible. Well, you're not.
What could happen next if Canadians don't listen?
You're not just putting yourself at risk, you're putting others at risk too.
Plus, games over. Breaking news about the Summer Olympics. And the legislation the federal government plans to introduce, the special powers the finance minister could be given. Plus, New Zealand has no deaths yet, but the whole nation has just been ordered into self-isolation.
Global National with Donna Friesen.
Enough is enough. Go home and stay home. This is what we all need to be doing. And we're going to make sure this happens, whether by educating people more on the risks or by enforcing the rules, if that's needed.
It is as close as the Prime Minister has come to saying he's ready to take the next step. Socializing, hanging out on beaches and in parks is not okay. Anyone who does it risks spreading the virus. Ignore it, and strict limits could be imposed on your personal freedom. Good evening and thanks for joining us. We begin with new insight into some extraordinary measures the government is proposing to tackle the COVID-19 pandemic. Global News has learned the federal government is poised to table a bill granting it sweeping new powers to spend money and raise taxes without having to get the approval of Parliament. Meanwhile, some provinces are putting tougher measures in place already to try to slow the spread. Ontario and Quebec are shutting down all non-essential businesses. Only pharmacies, grocery stores, and a few other services will remain open. We'll get to all that in just a moment, but first, a status report on the numbers everyone is watching. Positive cases of COVID-19 have now surged past 2,000 in Canada. BC, Alberta, Ontario, and Quebec are hardest hit. Together, they account for more than 90% of all confirmed cases, though every province and territory except Nunavut now has detected the virus. To give you a sense of how rapidly this pandemic is accelerating here, in the span of 3 days, the number of confirmed cases in Canada has more than doubled. Parliament is being recalled to pass urgent legislation in response to COVID-19. David Akin has breaking news about that. David, Global News has learned the government is proposing legislation that will give it extraordinary powers for quite some time. What can you tell us?
Right. Well, this legislation had been telegraphed last week, Donna, as pretty much pro forma stuff, going to formalize the $27 billion relief package announced last week, a relief package that was going to enhance EI benefits and enhance Canada Child benefits. But there may be some additional hiccups. Global News has been briefed on some of the contents of the legislation that the Trudeau minority government will put before the House tomorrow. One section of the legislation would give Finance Minister Bill Morneau special powers to raise taxes, lower taxes, and change existing tax law, all without Parliament's approval, either before the fact or after the fact. Not only that, Morneau would have this extraordinary power until December 2021. Now, we asked the Finance Minister's office to comment on this legislation, and what we heard from Bill Morneau's spokespeople was essentially that they're not going to comment until the legislation is actually tabled in the House on Tuesday. And they say they're working with all parties to see this legislation through. But this is a minority government that is essentially asking for a blank check to borrow, tax, and spend for the next 18 months without parliamentary approval. I can tell you that the opposition parties, all of them, were surprised when they saw the text of this legislation today. Surprise is an understatement, perhaps, and they're all very anxious about giving Morneau these new powers. And so what do? They are going to strategize overnight about this. They do have more combined votes in the government. Do they amend the legislation? Do they defeat it? That's what they'll have to discover. But Donna, just to sum up how historic this is, even in the First World War and the Second World War, no finance minister asked or got these kind of powers because, of course, Parliament was able to sit all through those crises, those national emergencies, and vote on legislation. And I'm sure the Liberals tomorrow will be saying they need some of these big powers because for the first time in our history, we may have to limit Parliament's ability to meet because of this public health crisis. Donna.
Absolutely extraordinary times and so much on the line. David, thank you. Let's go to our Ottawa Bureau Chief, Mercedes Stephenson. Mercedes, can you give us some context here on what this legislation might mean?
Well, Donna, it basically means that the finance minister can tax and spend, if this goes ahead, until December of 2021 without having to seek the authority of Parliament. And basically, the most important function that Parliament has is to approve things like taxation and spending of government money. Historically, through Westminster democracy, that has really been a focal point. The idea that you don't have taxation without representation. It's particularly remarkable in this case because it's a minority government that is asking for these powers that, as David said, are absolutely unprecedented. Even during times of world wars, you didn't have finance ministers who had the ability to circumvent Parliament to make decisions about government spending, raising or lowering taxes without having to seek the consent of elected officials. The fact it goes until December of 2021 is also remarkable. And right now, the opposition is trying to figure out what to do with this. They weren't expecting it, and they're frustrated trying to decide how to work with the government because they do want to make sure that people are able to get the resources they need, the same goal that the government has said that they have, but they feel that this ask goes too far in many cases, and it sets potentially a dangerous precedent. So it'll be very interesting to hear how the government defends why they're asking for something so extraordinary. And it's also raising questions for some MPs, Donna, about whether Parliament can do some of its work in another way, either with minimum staffing, from social distancing, or from home. They're saying that every other industry is learning to adapt to the new normal. Perhaps Parliament should too, instead of simply suspending, sitting, and making democratic decisions.
All right, Mercedes Stephenson, thanks. The Prime Minister's message to Canadians today is behave as if you have the virus and don't do anything that risks spreading it. Michael Couture on Prime Minister Trudeau's tough talk and what it means for you.
Listening is your duty, and staying home is your way to serve.
Practically pleading with people, Prime Minister Justin Trudeau's message to Canadians: your cooperation is key to limiting the spread of COVID-19. And despite weeks of repeating that, the government clearly didn't get through to hundreds of people in BC this past weekend.
When we see images of people out enjoying the sunshine in large groups, that is extremely concerning because they are not just putting themselves at risk, they are putting everyone else at risk.
Now, Trudeau still says nothing is off the table when it comes to forcing people to stay inside, including the Emergencies Act. And the Deputy Prime Minister says they will consult premiers about it during a conference call Monday evening.
Getting a clear sense of both what the situation is across the country and where the premiers feel they do or do not have the necessary tools in their own provincial and territorial toolboxes.
Monday, the premiers of Quebec and Ontario brought down the hammer. François Legault closing all non-essential businesses at midnight Tuesday as his province saw a massive jump in the number of COVID-19 cases.
We must put Quebec on pause until Easter for a possible restart on April 13.
Premier Ford is doing the same, but only for 2 weeks. And like in Quebec, both grocery stores and pharmacies will remain open. Ford feels the time to act is now.
Our resources are spread thin. We want to focus on making sure we flatten this curve and contain the spread.
Aiming to do the same, the federal government has earmarked $192 million of the billion-dollar COVID-19 response fund for research and development of a Canadian vaccine for the virus. Trudeau points out it will take months to develop a vaccine, so while that work is ongoing, he wants Canadians to do their part by staying apart. Donna?
Michael Couture in Ottawa, thanks. Well, there are thousands of people across this country right now bracing for what's coming. They're the medical staff who are already treating those who are ill with COVID-19 and those who are waiting. They all look to Italy and Spain and elsewhere, wondering, what if that happens here? Will we be able to save lives and have enough personal protection equipment to save ourselves? Abigail Bimman is looking into that tonight.
Global News obtained an email to staff at Lakeridge Health announcing the Ontario hospital is cancelling all surgeries with the exception of life and limb, saying the main reason to cancel is shortage of personal protective equipment.
We want everyone to know that we have adequate supplies.
The head of the Canadian Medical Association says otherwise, hearing from doctors nationwide.
They are worried that there is insufficient number of ventilators and an inadequate supply of personal protective equipment across the country.
5 days ago, pharmacists pleaded to be recognized as essential healthcare providers in terms of supply.
Pharmacies across the country are now putting up plexiglass around their dispensaries and plastic screens, but there is a definite, lack of supply of being able to get things like masks, gloves, other things like that.
The federal health minister was more specific.
I can say that we have enough PPEs for the next week or two.
Patty Hajdu urging hospitals facing shortages to talk to their provincial ministry.
We're working very closely with all of the provincial and territorial ministers of health to make sure that we understand what we have and how we can allocate it to meet very specific needs in very specific regions.
Former Health Minister Dr. Jane Philpott has joined the front lines, working at a COVID-19 assessment center trailer at Markham-Stouffville Hospital.
We actually have a special tent outside with a nurse who's wearing full protective equipment that's doing the swab.
While companies rush to help.
It integrates the functions of a ventilator, generating its own oxygen from the air.
Toronto's Thornhill Medical with a self-contained ventilator, Ottawa's Spartan Bioscience with a quick test.
You put that into our device, then you hit go, and then in 30 minutes it gives you your results.
Okay. Both among the company's promised federal funding, both waiting for further instruction before they can ramp up supply. Abigail Bimman, Global News, Ottawa.
The U.S. is quickly becoming a hot zone. There are more than 43,000 cases now, and New York City is a hot zone itself. There are more than 20,000 confirmed cases in New York State. There are outbreaks, too, in states like Louisiana, where millions recently celebrated Mardi Gras. As Jackson Proskow reports, it's deeply worrying and adding urgency to calls for a federal bailout.
New York is now the epicenter of the epidemic in the U.S., with more than 10,000 confirmed cases of COVID-19 in New York City alone.
I want America to understand, this week it's going to get bad.
Hospitals have been told to increase their capacity by at least 50%. A convention center in Manhattan is being converted into a 1,000-bed field hospital for the difficult days ahead.
That trajectory is going up, the wave is still going up. And we have a lot of work to do to get that rate down.
State governors are pleading with the White House to nationalize production of essential medical supplies like masks and ventilators.
We just received our allotment from the federal government's national strategic stockpile. Is it barely enough to cover one shift at that hospital? Not even a full day's worth.
100 million Americans, nearly 1 in every 3, face direct orders from their local governments to stay home. Louisiana, where more than 1 million tourists celebrated Mardi Gras last month, is reporting the fastest growth of confirmed cases in the world, according to local doctors.
This is disgraceful. We do not have time.
But as the U.S. economy nosedives, help is caught up in political wrangling. In Washington, lawmakers remain deadlocked over a $2 trillion aid package. Concerned unrestricted handouts to corporations won't offer long-term relief to the workers who need them.
Why do the members of the United States Senate continue to double down on stupid?
More than 100 people have died from COVID-19 in the U.S. today alone. Yet President Trump seems intent on lifting restrictions and getting people back to work as soon as possible, perhaps within 1 week. This morning he tweeted that the cure should not be worse than the problem, but his ambition flies in the face of the reality medical experts say the U.S. is now facing. Donna?
A grim reality. Jackson Proskow in Washington, thanks. There is more bad news for the airline industry tonight. Montreal-based Air Transat is temporarily laying off 70% of its workforce. All flight crew personnel will be out of a job, about 3,600 people. Some of the layoffs are effective immediately. Others will be more gradual, so the company can help repatriate Canadians. The last scheduled flight is April 1st. Air Canada, which has also temporarily laid off more than 5,000 workers, will repatriate stranded Canadians from Peru, Spain, and Ecuador this week. New orders in New Zealand and the United Kingdom coming up, 2 countries taking unprecedented measures. The Olympic Games are in serious doubt. A longtime member of the International Olympic Committee believes the Summer Games will be postponed because of the COVID-19 pandemic. And Canada has already stated that Team Canada will not participate. Eric Sorensen reports on the push to postpone.
Tokyo! The moment Tokyo won the Summer Olympics. Then 7 years of preparation. It's hard to let go for Japan and the International Olympic Committee. But former IOC Vice President Canadian Dick Pound says the decision has been made.
There's going to be a postponement, but they want to be able to put together all of the very, very complicated elements of a postponement.
There's still more than 4 months to go.
Thomas Bach and the IOC are still giving themselves 4 weeks before formally deciding, but postponement became virtually inevitable after the Canadian Olympic and Paralympic committees were the first to say their athletes won't be going. Issuing this statement, while we recognize the inherent complexities around postponement, nothing is more important than the health and safety of our athletes and the world community. Olympic trampoline gold medalist Rosie McLennan.
It's not the time where we should be trying to reach our peak performance or thinking about that. It's the time where we need to be focusing on protecting the vulnerable population.
Gold medal wrestler Erica Wiebe says it is the right decision.
I'm heartbroken, and I hope that this will, allow this IOC to take the right steps and postpone the games for a year.
And this Paralympic triathlete agrees.
Having this decision, we can actually truly take a pause from training and truly isolate and truly do what's best for the community.
It is heartache for the Japanese too. With Canada out, followed quickly by Australia, the games for this summer were clearly unraveling. In a room with faces covered in masks, the head of Japan's Olympic Committee was resigned. He suggests the postponing period shouldn't be long. It will still take weeks for the IOC to rework agreements for broadcast, hotels, facilities, and the overlap with other world sporting events next year.
The complexity of this is close to incomprehensible to understand.
But it had to happen. The Prime Minister thanking Canadian athletes for helping to make it happen.
But this was absolutely the right call, and everyone should follow their lead.
And it looks like the world will be following the Canadian lead. Eric Sorensen, Global News, Toronto.
Still ahead, New Zealand's Prime Minister acts fast and hard to avoid a worst-case scenario. New Zealand's Prime Minister is taking radical steps to contain COVID-19 there. Jacinda Ardern said today, "We only have 102 cases, but so did Italy once." She is now imposing a month-long nationwide lockdown. Every household will go into self-isolation from Wednesday night for at least 4 weeks, apart from people who work in essential services.
These decisions will place the most significant restrictions on New Zealanders' movements in modern history. Over the next 48 hours, people will need to go home, be it locally or throughout the country.
And Prime Minister Boris Johnson put the UK on lockdown today. He gave the police special power to arrest and fine people, still ignoring the advice to keep some physical distance from each other. In London, parks have been packed. People have crammed into the underground, even though cases there have surged to almost 7,000 and 55 people died today alone. Here's Crystal Gamansi.
This was the scene on the Tube Monday morning. No surprise, the government introduced new measures restricting when people can leave their homes, essentially only to buy groceries, go for a walk a day, and for medical visits.
If you don't follow the rules, the police will have the powers to enforce them, including through fines and dispersing gatherings.
The changes come as a group of healthcare workers confessed their fears.
We are facing our greatest challenge, and we're frightened.
We all have a choice. If you choose to stay at home, you will save lives.
Keeping those on the front lines safe is crucial. Efforts are underway to pack and ship more than 1 million masks and other protective items to healthcare workers in the UK. It follows the government's admission that there are not enough supplies for healthcare workers. The delivery has been tasked to the military. In eastern France, military members also called to action. This is one of many field hospitals being set up around Europe, With so many cases in Spain, a hotel in Barcelona has been designated a care location for patients with less severe symptoms. Never before in peace times have such steps been taken, in addition to border closures, curfews, and lockdowns.
More than 300,000 cases of COVID-19 have now been reported to WHO. That's heartbreaking.
Heartbreaking is the right word. Overnight, Sunday to Monday, there were more than 460 deaths in Italy. The new restrictions in the UK are aimed at preventing scenes like this. Crystal Gamansing, Global News, London.
Next, songs for self-isolation. Canadian Bruce Aylward is one of the top doctors tracking this pandemic. He's senior advisor to the Director General of the World Health Organization. I spoke to him today from Geneva. You can hear the full interview tonight on our network special, but here's a preview about what he says about isolating, testing early, breaking the chain of transmission, and what happens if you wait too long.
This is a virus that once it does take off, it's going to move and increase exponentially. And your measures, your control measures have got to be exponential as well to get in front of it. So small incremental measures won't work. And if there's a sense that you're losing control of these clusters, losing control of these transmission chains, you want to be moving very, very quickly in terms of measures that are going to really prevent people from interacting in a way that's going to just add more fuel to this particular fire.
You can hear much more later tonight in our Global News special, Coronavirus Canada in Crisis. And that is Global National for this Monday. I'm Donna Friesen. We leave you tonight with Toronto soprano Tea Kasahara. She's singing from a balcony, lifting spirits and soothing souls. Take care of yourself.